Hey, everybody. I am Dr. Dana Gibbs. Welcome to the Tuesday Live at 5:30. Tonight, we are going to have some straight talk about Armour Thyroid. So, what's all the fuss about Armour Thyroid and how can it help to treat hypothyroidism? What even is Armour Thyroid? So, many physicians and non-physician thyroid wellness practitioners alike advocate very strongly for Armour Thyroid or a different brand of the same basic thing, Nature Throid, that's no longer even available in the US market. So tonight we're going to discuss what it is and what the pluses and minuses of this preparation are. So I'm Dr. Dana Gibbs. I'm an integrative physician in North Texas. I'm a thyroid and hormone expert, and I help people address their fatigue and thyroid and other hormone imbalances. So if you're listening to this and you're not a physician, please keep in mind scientific proof is not nearly as black and white as people think. And in order to make treatment decisions for individual people, sometimes we have to consider advice and evidence that's not nearly as absolute as we'd like. So this is not meant to be medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. So natural desiccated thyroid has many brand names, Armour Thyroid being the number one most known, P Thyroid, West Thyroid, and now there's a new brand called Adthyza. These are all naturally derived thyroid hormone medications that are made from animal thyroid glands, most commonly pork, almost always pork nowadays. So these are available by prescription in the USA and have been around for over 100 years. And they contain the T4 and T3 thyroid hormones in a fixed ratio of 4-to-1 micrograms. They also contain the other carrier proteins that are naturally present in thyroid glands, thyroid hormone breakdown products, and the hormone calcitonin, which is also made in the thyroid in very minute amounts. They generally also contain various fillers and binders such as dextrose, lactose, or microcrystalline cellulose. Each one of those preparations is its own brand. So technically, there's no generic for Armour Thyroid. So if a doctor writes a prescription for natural desiccated thyroid, you could end up getting any one of those. All right, so let's talk about some of the problems with Armour Thyroid. So one supposed problem with any natural desiccated thyroid medicine is that it is not FDA approved, and I'm using air quotes here. This is because they are natural products that have been in commercial use since before the FDA even existed, and they got grandfathered in. The companies that sell them are not required to go through the $1 billion+ process to get FDA approval for their products. So insurance companies are going to tend to use this fact to deny coverage for these medications because they quote unquote lack FDA approval. And there are still sites on the internet that claim that natural desiccated thyroid is not approved by the FDA due to lack of evidence that's safe and effective for treatment of hypothyroidism. But the truth of the matter is that no large-scale studies were done because the companies literally weren't required to. So before synthetic, and by that I mean Synthroid, before that was synthesized in the 1950s, Armour Thyroid and the preparations like it were the only available treatment for hypothyroidism, and they were very, very helpful. But there were also no tests to determine whether the dosage was correct or not. So that was done strictly by symptom relief. They used something called the basal body temperature to decide whether people were getting enough thyroid hormone or not. And also by symptoms. Wow, imagine that, treating somebody until their symptoms go away. Anyway, then when the TSH test was invented in the 1970s, and it was discovered that most people's tissues could convert T4 to T3, which is the active form of thyroid hormone, the medical establishment assumed, with some help from the advertisers at Knoll Pharmaceuticals who make Synthroid, they assumed that it was no longer necessary to give people T3 and that synthetic was superior. And also that even though TSH tested a pituitary hormone and not the actual function of thyroid hormone, it was assumed that just testing TSH was enough. And many doctors still assume that. And that's a topic for another day, but it is not correct. Anyway, of course, that left the 23% of patients who did not get some symptom relief on the synthetic T4 preparations out of luck. All right. Another supposed problem with these naturally derived medications is that they tend to vary a little bit in potency from one brand to the next or from one batch to the next. And as one would expect, a natural product is going to vary a little bit because the amount of thyroid hormone in any given batch is determined by the animals that it comes from. So the manufacturers of Synthroid made much news out of this for years while suppressing studies that showed really shocking variability in the potency of the Synthroid product, and that Synthroid was not, in fact, better in studies, as they claim, than these other available brands. So, in fact, when these studies came to light in the late 1990s, and it turned out that Synthroid wasn't actually FDA approved either, they were fined over $100 million and required to submit a completely new application for FDA approval in 2003. It was a very interesting New York Times article that came out in July of 2001 that talks about this. Anyway, that said, with a single brand such as Armour, the potency is tested at the factory and varies very little, while many of the varieties of Levo, which is the generic name for Synthroid, are still allowed by FDA rules to vary from 80% to 125% of the stated potency. So that's over 40% variability. So Armour Thyroid, however, is, of course, a natural product with a fairly short shelf life in comparison with some of the synthetic drugs. All right, so how does Armour Thyroid work? So 1 grain or 1 60 milligram tablet or 65, depending on which brand you're talking about, contains 38 micrograms of T4 for every 9 micrograms of T3. And the reason so many people swear by these medications is the fact that they do contain that T3, which is the active form of thyroid hormone. And this is particularly helpful in people whose bodies do not convert T4 to T3 very well. It's also one of the reasons doctors are so reluctant to prescribe them, because active T3 can have powerful effects on the body. And if you give it carelessly, too much, too soon, or too quickly can induce hyperthyroid side effects in people who have been, especially in people who've been really low in T3 for a long time. So this is particularly true in the presence of caffeine, for example, which many hypothyroid patients overuse just so they can stay awake. And this is also, of course, true of synthetic T3, which is called liothyronine. All right. Also, for some people, that 4-to-1 ratio happens to be the perfect ratio, but for many people, it's not. Some people need a lower amount of T4 for every microgram of T3, or maybe higher, but mostly they need a lower amount. So the dose that makes you feel better on the natural desiccated thyroid, if you need less T4, would actually push your TSH number down below the normal range. At the same time, it pushes your free T4 too high in order for you to feel somewhat normal. And this can have negative side effects. Particularly, doctors worry about heart effects and bone health effects when TSH gets too low. And there's a lot of studies that show that that's the case. So many doctors and other thyroid advocates don't know that elevated T4 levels also result in more production of reverse T3 and also less T3. So I have discussed the harms and the problems of elevated reverse T3 in other live sessions. And of course, this is also a major problem when people are given levothyroxine or Synthroid by itself. About 20 to 23% of those people will not feel better on T4 or levothyroxine by itself. So physicians and other practitioners who don't follow the T3, reverse T3 ratio levels tend to use Armour Thyroid or other natural desiccated thyroid products incorrectly. They tend to push that dose higher and higher. They get more T3 that way, but they also get higher reverse T3 and very high T4. So not great. But another thing about Armour Thyroid is that because it contains T3, which only lasts a really short time in the body, they don't realize that it's really a lot better to divide it into 2 or even 3 smaller daily doses rather than one big one. So if you do that, then the levels don't get really high and then really low over that 24-hour period if you would only give it once a day. So doing this means overall, doing this multiple times a day rather than once a day means overall you need less medication. You will feel better. You'll tend to make less reverse T3 and your TSH levels won't go as low or as high on the same amount of medication. So there have been attempts made by compounding pharmacies to make a sustained release version of T3, but this actually just reduces the total amount of T3 a patient can absorb, and they end up once again with inadequate T3. And so still not a great thing. But a final thing about taking natural desiccated thyroid that's a concern of mine, and this is regardless of the brand, is that since it's made from whole animal thyroid glands, it has more in it than just the T4 and the T3 hormone. There is concern that those extra ingredients contain 2 proteins, in particular thyroid peroxidase and thyroglobulin, both which are proteins that are inside your thyroid gland or that carry the thyroid hormone around in your bloodstream. And these 2 are the exact proteins that are attacked by antibodies in Hashimoto's disease. So it is possible that having those proteins circulating around in your GI tract and in your bloodstream could trigger a rise in the very antibodies that attack your thyroid and damage it and cause the low thyroid condition in the first place. So this is another reason that I personally prefer for those Hashimoto's thyroiditis patients who have hypothyroidism to use T3 and synthetic T4 in whatever ratio and whatever combination is needed when I'm treating those patients. So these kind of treatment decisions are really made on a case-by-case basis, taking into account the other conditions a patient might be suffering, the degree of their symptoms, the potential side effects of different brands. So once again, this is not meant to be individual medical advice. And if you believe you have a medical condition of any kind, you should consult a knowledgeable physician. So if you want to know more about treatment of thyroid and other hormone disorders using an individualized, holistic approach, sign up for my newsletter at www.danagibbsmd.com. And if you're looking for an expert doctor to help you resolve your hormone imbalance symptoms, you can find more information about my practice at the same website, danagibbsmd.com. And my end of the year, so I've had an introductory special going on all year that is going to expire at the end of the year. But if you get on my patient list before the end of the year, you will continue to get the introductory prices. So thank you for listening, everybody. And I will see you next week. Have a great holiday. Bye-bye.